Let me help you live your best life. This is Jason Williams, DO. This is the Williams Family Medicine Channel. Today I wanted to talk about medication prescribing when using low-carb, high-fat diet. For patients that are starting a low-carb, high-fat diet, it is very important to review medication lists. There are medications that will need to be modified or even discontinued if a low-carb, high-fat lifestyle is implemented. This is an exciting time for patients. You don't know how many times I have patients come to see me that bring a long medication list and plead with me, "Doctor, please, can I get rid of some of these medications? All I do all day long is take medications." This is one time when we can de-prescribe medications safely and effectively at the same time that their health conditions are improving. If you are my personal patient and you are watching this video, you and I probably already discussed this in the office, and it is very important to have an individualized plan. If you have your own doctor, you need to discuss this with your own doctor before implementing low-carb, high-fat diet and any medication de-prescribing for your own safety. I categorize the medications in a couple of lists that include ones that you can continue with low-carb, high-fat diet, ones that you should stop immediately, and ones that you should decrease the dose immediately. When initiating a low-carb, high-fat diet, it is very common for the insulin level to drop and the blood sugar to drop. If you have a low blood sugar and become hypoglycemic, that can be dangerous for you. During the time of transitioning to low-carb, high-fat diet and possible medication de-prescribing, I'm more willing to tolerate a slightly elevated blood sugar to prevent hypoglycemic episodes. I have a target for right around 140s, 150s for blood sugars. Anything below that consistently makes me concerned that patients are at risk for hypoglycemia during this short time. Medications that need to be stopped due to the hypoglycemic risk include short-acting insulin. Some patients are on very high doses of short-acting insulin, and in those cases, I might have to decrease the dose before completely stopping them. But in general, short-acting insulins will be discontinued within days in many cases. Patients need to monitor their blood sugars carefully to make sure they're in an appropriate blood glucose range. It's common to have to decrease doses of long-acting insulins, but not as aggressively as the short-acting insulins. Once again, this will be an individualized approach with each particular patient based on their dosing. Sulfonylureas, such as glipizide, need to be stopped right away due to their hypoglycemic risk. They also carry the risk of weight gain anyway, so not the best medication choice for many. SGLT2 inhibitors, such as Jardiance, Invokana, and Farxiga, need to be stopped. There's a risk of euglycemic ketoacidosis, which can make patients very sick and require hospitalization. Alpha-glucosidase inhibitors such as acarbose should be stopped. Meglitinides such as Starlix and Prandin should be stopped. And glitazones such as Avandia and Actos should be stopped. The glitazone class of medicine is not that effective anyway. The following medications are okay to keep. They include metformin. Next class that we can keep are GLP-1 agonists such as Byetta, Trulicity, Ozempic, Rybelsus, and Victoza. DPP-4 inhibitors are also okay to keep, and these include Tradjenta, Januvia, and Onglyza. When I classify these medicines as okay to keep, that does not mean that all patients stay on these. If you look at studies such as the Virta Health study, you will see that some patients have completely discontinued all of their medications when they have initiated low-carb, high-fat lifestyle. This will be an individualized approach with each patient. I want to stress that. When we think about the effects of decreased insulin and blood sugar, we also think about fluid shifts. People that have decreased fluid and decreased salt, they can become dehydrated, they can have electrolyte abnormalities. This leads us to the next medication consideration, diuretics. The two major classes of diuretics are loop diuretics and thiazide diuretics, and both of these can be stopped. These medications include hydrochlorothiazide, Lasix, and Bumax, to name a few. We have to be thoughtful about these medications and other coexistent disease states such as congestive heart failure, but it is very common that you can greatly reduce these medications or even discontinue them. It is also very important to monitor blood pressure. Patients that have a persistently low blood pressure, lower than 120/80, and especially if they experience signs of orthostasis such as dizziness, lightheadedness, weakness, they will need to have their medication doses greatly reduced or even discontinued. I do not want my patients to experience side effects of initiating low-carb, high-fat lifestyle. I want them to be careful. I want them to talk to me regularly. I need to have them monitoring their blood pressures and blood sugars carefully. I don't want them to fall. I don't want them to become hypoglycemic. This is a great opportunity to live your best life. You're able to get rid of some of your medications, the cost of the medications, some of the side effects and risks. You help me live my best life at the same time. Now I have less medications to manage and consider side effects and interactions, so both the provider and the patient are happier. This video contains information, but this is not intended to be your own personal medical advice. If you are my patient, you can use this video as a supplementary educational piece. However, you and I need to discuss this in the office. If you are not my patient, you need to see your own doctor and discuss your healthcare plan with them. Thank you for your attention. We'll catch you on the next video.